In this video, we will discuss about cervical cancer, symptoms, causes, risk factor, and lastly, prevention. So, firstly, we should know about the cervix. The cervix is the lower part of the uterus that connects to the vagina. The cervix allows fluids, such as menstrual blood, to pass from the uterus into the vagina. It also widens during the birth of a baby. So now let's talk about cervical cancer. Cervical cancer is unwanted growth of cells that starts in the cervix. Various strains of the human papillomavirus, also called HPV, play a role in causing most cervical cancers. HPV is a common infection that's passed through sexual contact. Coming to the symptoms of cervical cancer. When it starts, cervical cancer might not cause symptoms. As it grows, cervical cancer might cause signs and symptoms such as heavier and lasts longer, menstrual bleeding, pelvic pain or pain during intercourse, vaginal bleeding after intercourse, and watery, bloody vaginal discharge. Now the most important point, causes of cervical cancer. Cervical cancer begins when healthy cells in the cervix develop changes in their DNA. So why this DNA changes happens? It is because of HPV, which is transferred through the sexual contact. HPV is most common cause of cervical cancer. So what kind of risk factor can appear? Let's see. Firstly, having sex in early age can increase the chances of having cervical cancer. Having too many sex partners can increase the chances of getting HPV. Next is smoking. When HPV infection happens in people, those who smoke it tend to last long. The infection, weakened immunity, can also prone to develop cervical cancer. And lastly, miscarriage prevention medications increases the chances of getting HPV. Now the prevention. As we know, prevention is better than cure. So let's focus on prevention. Always practice safe sex to reduce the chances of getting HPV. Use condom during sex and also reduce the sex partners. You can receive HPV vaccine to mark safe yourself. And lastly, have Pap test routine for yourself to detect precancerous stage of cervix. Most the medical organizations suggest to do Pap test at the stage of 21 and repeat the test after few years. Thank you so much for watching. If you think this video is helpful to you, please give a thumbs up and do subscribe to our channel. Till then, take care.